Good afternoon, everyone. I'd like to call the Finance, Ways and Means Committee to order for February 8th, 2022. Madam Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gant,
Here.
Garrett, Gillespie, Hawk, Hicks, Lamar, Lambert,
Gant.
Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chair Lady Hazelwood.
Here.
Madam Chair Lady, you have a quorum.
Thank you, Madam Clerk. Are there any personal orders or announcements? Seeing none, I would like to take this opportunity to introduce our committee staff, as we have not done that during the session so far. We have our Legislative Budget Director, Jessica Himes, who stepped out. She'll be back. We have Fiscal Review Director, Crystal Lee Carson, that I know all of you know already. Our attorneys, Joel Hayes, Doug Garrett, and Anastasia Campbell. And right now they're leaving. Oh, we have one in the house, so we are not without legal advice. Thank you. My administrative assistant, Miles Buell, I'm not sure if he's still here, and research analyst, Mirna Tunich. I'm going to get that. Let's see. It's been 3 years now, Mirna. I'm going to get it before the end of time. And Tanner Poss. And I want to also introduce my intern that's working in my office from Vanderbilt this session, Sherry Gerges, House Clerk Jordan Nickel, and Katrin Latham. We have our library and our archives, Kim Wires, and our Sergeant at Arms, who's keeping us all safe and on target, Tommy Woodward. So please join me in thanking them for being here. Also, just a bit of a housekeeping announcement. This is not a change, but just want to make sure that everybody is aware of how we're doing bill notices and amendments in this committee. Bill notices and proposed amendments best be submitted electronically. All amendments have to be filed with the full committee through the corresponding Outlook distribution list. And this process will automatically request a fiscal memo in your behalf, so you don't have to do that separately. And in the past, again, no change, Finance Committee, we do not accept verbal amendments in this committee. And the deadline to submit proposed committee amendments is Monday at 10 a.m. So again, nothing new, just a reminder of how we have normally done our business. Also, just as a kind of order of business so everybody will know what to expect today, we do have 2 bills on the calendar. We're going to be taking those up. Then we're going to be hearing from the Department of Health and the Department of Human Services. Following those presentations, we'll also have just a brief hearing on their budget expansion requests, which have been submitted. So without further ado, we will get underway. The first item on our calendar is House Bill 14. Sorry, let me grab the right calendar. That would be helpful. House Bill 952 by Littleton, and at the sponsor's request, that bill has been taken off notice. Next on our agenda, House Bill 1392 by Freeman and a host of other signees. I have a motion and a second. Representative Freeman.
Thank you, Chairman and Committee. House Bill 1392 is a very simple bill. It's a statewide bill. It simply authorizes local governments to regulate entertainment transportation. It defines entertainment transportation as a motor vehicle for hire that provides entertainment and transportation. It excludes cabs, limousines, sedans, and shuttles, and it's permissive. And it provides local governments a way to respond to the problem, which not all have yet, but it gives every municipality an opportunity to regulate this industry.
Right, you've heard the explanation of the bill. There is an amendment that has been filed by Chairman Todd. The drafting code on that amendment that I have is 012911. Chairman Todd, is that the correct code. Is that your amendment? Would we have a motion and a second? Would you please explain your amendment to the committee?
Thank you, Madam Chair. This does just a couple of things. It it basically says that any entity that's in existence now in this business shall be issued a permit if they jump through all the hoops that the locals lay out for them in the permit process. It leaves the vagueness about whether those existing businesses could be discriminated against, in my opinion. They put out capital. They've been working in this space for some time now. They have contracts for advertisement. They have bookings at certain prices. And if the locals decide to put more restrictions on them, then they shall issue the permit if they answer all those questions and provide the insurance and do all the things that are requested. That's all it does. It's simply, in my opinion, a bill that protects private businesses from in an unregulated space now that regulations are being drafted for that.
We are now in discussion on we are in discussion on the amendment, drafting code 012911. Is there discussion? Representative Lynn.
Thank you, Madam Chairman. Representative, your amendment is your intent to just bring in the existing businesses? Is your intent that they could not turn down any, like, let's say they got to so many of these transportation or entertainment vehicles, would they be able to at some point set a limit and say, look, we have enough and we don't really need any more in this small downtown area? Would they have the ability to set that limit? Is your intent just to bring in the ones that already exist?
Chairman Todd.
Thank you, Madam Chair. The amendment as it is written is to address only the existing businesses in that space. So if they decide in the future, if the locals decide in the future that this one is enough or this 10 is enough, whatever there is right now, then they certainly can restrict those. It would not have any effect on those in the future.
Representative Freeman, I believe it's your bill, and so if you'd like to comment on this amendment.
Yeah, thank you, Madam Chair and committee. So I just want to make sure everybody's aware of exactly the process that this bill has worked through. It was first proposed last year and passed through the subcommittee. There was some concern that the stakeholders had not had an opportunity to be at the table. I agreed to roll it until this year so that we could have these conversations with all the individual stakeholders. Those meetings took place. The rules were proposed as we were going through this process. The bill came back on transportation at the beginning of the year, passed out of transportation, went through finance sub, passed out of finance sub. We are now sitting here at the full finance committee with an amendment being put on the bill that does nothing or says nothing about it's a date of April 1st. It leaves the possibility that an operator could go out and get 100 permits, 200 permits, 500 permits, and the city would have no ability to limit to the point of my colleague a second ago, the number of vehicles on the road. We had an event last weekend with a large fast food restaurant was in town. 6,000 people. They had a bunch of buses parked on the road. It literally shut down the city. People could not operate. They couldn't move around the city. If we are not able to limit the number of buses and on the road at any given point, it's a safety hazard. Heaven forbid somebody has a heart attack downtown and or a bar or restaurant catches fire. We will not be able to get life safety there. And I have been working this bill. I've probably talked to everybody in this room more than once. It's very important for my community. It will be very important for your community very soon. And I ask everybody to not support the amendment, support the bill as is. It couldn't be simpler. It's a very straightforward bill that gives local authority to regulate a local issue. And with that, I ask for you to not support the amendment. I'm not sure what the exact policy, or what do I need to say to? Yeah, vote no. Yeah. Thank you.
Representative Ogles.
Thank you, Madam Chair, and to the amendment sponsor. I appreciate the effort to protect, I would say, new business. But I do think, and I'll agree with the bill sponsor, they need the ability to regulate this industry. And in essence, I'm afraid that your amendment would grandfather certain businesses in place and actually lower the bar that we're going to put on this industry. So I'm just afraid that your amendment might have unintended consequences. But I'll rest. Thank you.
Chairman Williams and then Todd.
Thank you. Representative Freeman, I appreciate your work as it relates to this very important topic in your district. I'll be supporting Chairman Todd's amendment. The reason why I'm supporting Chairman Todd's amendment is because these people that would be impacted if we don't grandfather them in will not be able to operate their businesses. There's no guarantee that they would. They've gone out and made great investment, invested in this community. There could be argument they're good actors or bad actors, but your bill would still regulate those folks. And regulation is what you wanted. I think that's what everybody on this committee wants to do, is to regulate. But the concern is Metro Nashville Council has a history of running people out of business because with their permits process. All it says, if they want to be a good actor, then they shouldn't have a problem with doing this. And so I can appreciate the concerns. I think the posture in this amendment maybe would give us an opportunity to have a further discussion about it. But I don't understand why, if they really cared that this business was grandfathered in, why oppose the amendment? All it does is says the number of people that are registered now, or these vehicle registrations that are purchased, they'd be able to currently operate their business. And so to me, it seems like it is an admission that you want to run these people out, not you personally, but that the municipality wants to run this one entity out of business because they won't grandfather them in. So it's almost like they're telling them that that's what's going to happen. So I'm going to be supporting Representative Todd's amendment. And I think we said in subcommittee, with all due love and respect to the bill sponsor.
Chairman Todd, you're next on my list.
Thank you, Madam Chair. This certainly does not grandfather any existing business in from the standpoint of the new regulations, of the new permit process. It just says if you jump through all the hoops that the municipal lays out in their permit process, then you shall be issued a permit. That's all it says, so that they cannot just indiscriminately put that company out of business or those companies that exist. Now, we picked April 1st because that's the date that the permit process would go into effect, according to what Metro, the current situation that we have now, and what Metro has passed, is my understanding. I don't mind changing that date to January 1st of this year if we needed to, but we picked that because that's when this particular permit process goes into effect, as I understand it. So it is this amendment is a pro-business amendment that just says we don't like changing the rules in the middle of the game without giving the existing players a fair shake. That's all it addresses. Thank you, Madam Chair.
Representative Freeman, you're next on my list.
Thank you. And I again appreciate the intent. This whole thing is a pro-business bill. It's supporting a business, getting it into a safe, regulated space that people know are going to be able to get off the bus at the end of the trip, and it's a safe space. The comment of they may or may not issue the permits. there's nothing here that says they're not going to issue permits. There was a meeting last night with all the stakeholders, and the director of the TLC said he has no reason to believe and no reason to not issue permits. It's simply we've got to be able to regulate the number of buses on the roads, and if this passes, we can't do it. And I know that you are willing to change the date, but I mean, we've been dealing with this for a year. And if you're willing to change the date, to me, that's an admission that there is maybe a not so perfect solution in front of us with this amendment. So again, I ask that you vote no for the amendment. Let's pass this bill, and let's just move forward. Thank you.
Representative Garrett.
Thank you, Madam Chair. This legislation's been heavily lobbied, for lack of a better word, and I'm still a little bit confused on it. But I'm curious, and I don't know if this is for Chairman Todd or for Representative Freeman. If the amendment goes on the legislation, are we talking about one company being affected, or is it the entire industry? Representative Williams mentioned there was one entity that we're affecting with this particular amendment. So I'm a little confused if we're passing legislation and then we're passing legislation with an amendment for one company. Is there anyone that can kind of enlighten me on what the amendment is doing, and how is an amendment preventing a business from operating?
All right, since it's Chairman Todd's amendment, we're going to go to him first and then to Representative Freeman.
Thank you, Madam Chair. My answer to that would be, I don't know how many people are in this space right now. I don't even care. At this point, they're operating, and Metro is looking at putting regulations on them and a permit process in place. And the bill, before it's amended, says that we're allowing Metro and other municipals to put those regulations. Right now, they can't do that. They can't regulate them. So we're allowing them to regulate. And I'm not opposed to the bill at all. I just want it to say, for those existing businesses, however many there are, if it's 1 or 50, I don't know, don't care, that we're fair to them. We're going to treat them fairly and say, if you jump through all these permit hoops, you're going to get a permit. That's all I'm saying. That we're not putting somebody out of business unfairly. I think it's unreasonable to change the rules in the middle of the game without giving them a fair opportunity. That's all this is about.
Representative Freeman.
And thank you, Madam Chair. There are multiple businesses within this industry right now, and the idea that we are somehow surprising them with this is just not an accurate statement or belief. Again, I ran this bill last year because there was confusion, agreed to roll it to this year. So from the end of last session to January, we have been working to finesse what this ordinance would look like. And at no point along that process was there any fear conversation about this. I'm afraid that this is some people within the industry that just they don't like the regulation, and so they're trying to sow confusion. Again, you were initially confused over what we're doing. I asked that everybody vote against the amendment. Let's pass a very simple, straightforward piece of legislation that simply gives municipalities the ability to regulate this. It's a state licensed vehicle, and the municipalities need our approval to be able to regulate them. That's all I'm asking.
Chairman Williams, I believe you noted that your name was called.
Yeah, just as a clarification, Chair, Leader Garrett, I've never talked to anybody in this space as far as the business owners are concerned. My concern is that we currently have an unregulated business, and I too support the Representative Freeman's bill and the idea of regulating this business. But in the process of trying to regulate the business, Representative Todd's bill or amendment would say that you can't run those people out of business that are currently operating, whoever they are, whether it's 1 or 15. it from being able to do that. Some of these people could have bought 2 buses. Some people could have bought 15. But if they go through this permit process of regulation, of which we all want statewide, then what could happen is that Metro Council or Sevier County or whoever is doing it could say, no, we know you had 10 before, but we only want you to have 2. If the bill sponsor may give me some comfort if he wanted to say that the Metro Council has done a study as it relates to their ordinance and they feel like only 10 buses are appropriate. At least we could have a window into what it is how many they're wanting to regulate, but we're not saying this. And as it relates to working on this a year, there's no doubt he has worked very hard on this. I think he's passionate about it, and we all want to represent our districts, and he's doing a great job. I think in this instance, though, it's only been before this committee in the last 2 weeks. So it was in subcommittee last week, and it's in here today. And so I can appreciate the bill sponsor, and whether the amendment goes on the bill, I'll support the bill. But if we need to slow it down, we need to slow it down. And I think in this instance, it better clarifies that. I have an instance where this same process happened with VRBOs, short-term permits. Next thing you know, the governing body decides they don't want to issue permits, even though they met their requirements in the ordinance. And so it really, it is really concerning for me. And so I think that whoever the business is, if they're operating now, they should be able to operate tomorrow, and that the new growth and the existing business should be regulated.
Chairman Hicks.
Thank you, Chair Lady. And this kind of, I guess, piggybacks on what the Chairman Williams was just talking about. So, and Chairman Todd, just a hypothetical. So if I'm an owner and I have 15 of these entertainment buses, so right now there's no limit. I've got 15, an ordinance changes. It says, okay, you can't have any more than 5. So at that case, what would this amendment do to me, I guess? If I've got 15, the ordinance changes to 5, then what happens? Kind of walk me through that.
Chairman Todd.
Thank you, Madam Chair. If you're in business right now, prior to April 1st of this year, then you would have to comply with all of the permit requirements that the city council passes that goes into effect on April 1st. And if you do that, then they shall issue a permit for what you currently have. I think if you add any more, my intention would be that we're not adding any more people to this space necessarily from the standpoint of this grandfathering in. And the grandfathering is only from the standpoint of current permitting, current operation, not permitting. That if you're operating now, they're not going to put you out of business. That's the main issue here, is they shall issue the permit, not may issue the permit. I just don't want to leave it up to their discretion to pick winners and losers from a space that's already there, from businesses that are already operating, that have customers booked, that have advertisers booked for part of this year.
Representative Freeman.
Thank you, Madam Chair. I want to piggyback and also answer that question as well. And before I say that, I want to make a statement. The industry association supports the bill and has opposed the amendment. And part of the reason why is exactly to your point. If someone's got, right now, we don't even know how many operators there are. So there's no way for us to be able to even begin to say who gets grandfathered in, who doesn't, what that number is. Somebody could say they've got 200 buses. Somebody could say they got 5. We just don't know. And so we're grandfathering in an artificial or manufactured number that then ties the hands of the city to be able to regulate. And if we've got, again, 200 buses on the road on a Friday night and we can't operate traffic effectively, municipalities have got to be able to regulate how many of those party buses are on the road at any given point. I've said over and over again, and I'll say it again, I have no interest or desire to put anybody out of business, but that same business could be a bar downtown. And if you can't, or a restaurant downtown, and if you can't get to that bar or restaurant goes out of town. So at some point, there's got to be some regulation for safety of the residents in downtown Nashville, in Memphis, in Jackson, in Knoxville. It's coming to your community. So again, I ask that you vote against the amendment, and thank you.
Leader Camper.
Thank you, Madam Chair. Just wanted to say that I do support the bill. I don't support the amendment, and I don't know why there's this perception that there's an intent to put people out of business. There's nothing in the bill that does that. The people who already have the buses probably are already permitted. And I agree with the sponsor of the bill that at this point, we don't know how many buses anybody may have. And so to put a shall on the local government, to me, is really tying their hands. And so if we say that we believe in local government and their ability to manage their resources and manage what they have for their municipalities, I think we need to support Freeman on not accepting this amendment, because I think we're going to be tying their hands and there's going to be some unintended consequences by doing so. So I would ask that you just vote against the amendment and let's just pass it clean and allow the locals to, first off, get a hold and manage what we have and then start charting a course forward. Thank you, Madam Chair.
And Chairman Zachary, I apologize. I overlooked your name on this list.
That's all right, Madam Chair. Thank you, Madam Chair. To the sponsor of the amendment, just to make sure I understand, to address and alleviate Representative Freeman's concern, this amendment allows Nashville Davidson to regulate these entities, correct?
That is correct.
And the intent of your amendment is to preserve and protect the business owners who have made a substantial investment to ensure that they are able to continue to run their business moving forward, correct?
Only if they comply with the new permit process.
And one more, Madam Chair. So the concern I have with the amendment is the date. So if we put the amendment on, is there anything within your amendment to keep those business owners from immediately doubling their fleet, taking additional steps for expansion until April 1st, which creates a larger issue for Davidson because these entities have expanded beyond what their current operation is with the expectation of April 1st?
Representative Todd.
Thank you, Madam Chair. This doesn't address the number of units any company has now or will have in the future. So any of them right now, before this ordinance goes into place, April 1st, can add as many units as they want to. All we're doing with the bill is allowing them the ability to pass that ordinance and make it go into effect April 1st. The amendment says if you do that, any business that's currently operating doesn't address how many units they have, but they would still be able to operate if they comply with the permit process. They shall be issued a permit. That's all it says. For the sponsor to bring this and say that he's worked on this for over a year, but not even know how many businesses are operating in this space is kind of odd to me. If we've got that big of a problem that's created this, I would think there's some number that there's a number known by the city council that they've been advertising to say, we've got 100 and we should only have 10, but that hadn't been communicated. So apparently we don't have an issue right now, except they're not regulated. And the bill, as I support the bill, simply says that the locals can regulate them. And my amendment only says you shall issue the permit if they comply with the permit process and all the requirements, insurance, safety, all of the requirements that you shall issue the permit for those existing businesses. Anybody on this committee that is pro-business, that understands what it is to run a small business, to make an investment, I don't see how you could be against this amendment. It's really straightforward. It just says if you comply with the permit process, which we would allow with the bill, you shall be issued the permit. That's it. But you have to comply.
Chairman Zachary.
Thank you, Madam Chair. And so I support the structure and the intent of the amendment. My concern is what's going to happen to the market between now and April 1st. And as someone I'm on Finance Full, I have not seen this legislation or this amendment till I read it today, and I've been lobbied by both sides. So if this committee is willing, based on this, I think we could probably find some common ground, because just based on the discussion we're having just right up here in the split on the amendment, if the committee would be open to it, Madam Chair, I'd make a motion that we roll this 1 week to get this in a better posture for discussion.
Representative Freeman, and then we have a number of other people, so,
Thank you, Madam Chair. And again, going back to the previous comments, my bill is extremely simple. I feel that this amendment's brought a lot of questions and confusion to this. There are roughly 45 operators right now. I do know that. We've talked to most of them, most of the industry. And the number of buses is the real question. And I've said this again and again. If Metro overreaches, which I don't believe they will, or if Knox County overreaches, or Shelby County overreaches, I'll be the first person to come back and do something to fix this. But we've got to give them the ability to do it. So, thank you.
Chairman Faison. All right, the question has been called on the amendment. Any objection to calling the question? Seeing none, we are voting on the amendment. All in favor of the amendment, please signify by saying aye.
Aye.
All opposed? No. Noes have it. The amendment fails. We are back on the bill as presented. The question has been called on the bill. Is there any objection to calling the question on the bill? Seeing none, we're voting on the bill. All in favor of House Bill 1392, please signify by saying aye.
Aye.
Any opposed?
No.
The ayes have it. And the bill moves on to calendar and rules. That completes our simple calendar for today. We're now out of session, and we will be hearing from our we will continue with budget hearings. First up will be the Department of Health, and I must make a correction. Earlier, I mentioned that we would go straight from the department's presentation to their expansion request, but we did not put that in our notice. So we will hold that expansion request hearing at a later time. So, but if you will please come forward, and we'll begin with telling us about your budget, Dr. Piercy.
Thank you, Madam Chair. Good afternoon, committee. I'm Lisa Piercy with the Department of Health. To my right is Dr. Morgan McDonald, the Deputy Commissioner of Population Health. And to my left is John Webb, our Deputy of Operations. Okay, so I'm going to go through this. It's quite a bit of detail. I'm going to hit the high points, and then if you want to dig into anything, happy to do that as well. So on these first couple of slides, we're going to go through the cost increases requested by the department. The largest line item is that for our dental services pilot program. You have probably heard me and others talk about that in the past. We convened a stakeholder work group of about 22 or 24 folks that met multiple times throughout spring, summer, and into the fall, mostly from dental schools, private sector, private dentists, rural areas, and came up with a recommendation for a multi-year way to address the significant shortage of dentists and access to dental care in Tennessee. The original proposal is 5 years and $94 million. What you have here on the screen represents the first year of that at just shy of $11.9 million. The overall proposal including this first year, is about 2/3 to the dental schools to increase their class size, and the other third would be administered by the department for recruitment to rural areas, loan repayment, as well as some ancillary services for the underserved, like prosthodontics, things like dentures, et cetera. This would require no new positions. The second line item is a provider rate increase. This is for our safety net providers. As a reminder, the safety net are the providers across the state that care for our uninsured patients. This is just shy of $2.2 million, and again, adds no FTEs. The first line item that we have that does add FTEs is a true need for increase in services. It has 4 FTEs and a price tag of about $324,000 per year for the addition of 4 restaurant inspectors. These are primarily clustered in Middle Tennessee and Sevier County. We've had significant growth in our restaurants. A typical caseload should be around 800. Right now, those guys are handling between 1,000 and 1,200 on their caseloads apiece. So this would be to even out that workload and respond to the increased demand for restaurant inspections in those 2 areas. Number 4 is for 2 positions in our Board of Nursing. They're administrative positions that have been filled with contract employees. It is now to the point where that is costing us more than it would be to employ them. So that does add 2 FTEs, but that is in replacement of contract employees. Numbers 5 and 6 are in our licensure and regulation department or division. And this is also just the increased workload and increased caseload. This is to speed up throughput and be better more responsive in a timely manner to our licensees. Both of these amounts are covered through board fees, but those are recognized as state income. And so I just wanted to make that note for you. Number 7 is our suicide prevention director position. That is currently filled, but it has been filled with short-term funding, which expires this next year. And so this would just be to solidify that with recurrent funding for a very crucial position, very important work. Number 8 is for a position. Number 8 and 9 are reclass positions, so no FTEs there. But number 8 is for a bioinformatics position in our state public health lab. That's essentially for genomic sequencing. So if you've ever heard of a variant for any type of infectious disease, and there are variants in other diseases other than COVID, that work is expanding very, very rapidly. Actually, I had the pleasure of taking Chairman Watson on a tour of the lab yesterday, and that was one of the things that my staff brought up to him right off the bat, which is how much our genomic sequencing work has increased in many, many conditions. They've already had to expand that space into conference areas and double up other spaces. And so we need a bioinformatics technician to be able to run that work. Number 9 is an additional attorney in our Office of General Counsel. As you probably can guess, we are inundated with records requests and lawsuits and all of the things pertaining to what we've been through over the last couple of years. So this is another reclassed position, not adding an FTE, but asking for recurring state funds for an additional attorney position. The biggest item on here is our $15 million request for a LARS upgrade. LARS is the software system that is done for our licensees. We license over 300,000 Tennesseans across multiple health professions. And LARS has served us relatively well. That was our first attempt at going from somewhat of a paper system to an electronic system. It does not have all of the, if you're familiar with the terms UI and UX as it pertains to software, that our licensees need and want, particularly to be able to do that in a user-friendly way on mobile devices and in tablets. And so this would be coming from dedicated board reserve funds. So this is not out of the state budget. This is out of our board reserves. The last few items are also not pertaining to FTEs, but some smaller amounts for operational needs. Number 11 is to improve our data analytics in our Office of Informatics and Analytics. This is primarily our overdose and substance use data, but it also encompasses many other things throughout the department, and they need some additional funding to help streamline that work. Number 12 is something for to add to our routine lab equipment replacement cycle. So we came to you last year, and you were very gracious to allow us $500,000 a year to replace our routine replacement of lab equipment. This is adding another 500 to that, so we will be on a fully funded routine equipment replacement cycle in the lab. As you can imagine, that laboratory equipment has been used quite a bit lately, and it's very expensive. Finally, the last one is a payroll realignment in our Office of Informatics and Analytics. This has been federal funding going to the payroll, but the grants related to this federal funding are very restrictive in what we need to be able to do. So we're requesting to shift the payroll functions to the state dollars and keep that federal funding and use it for other purposes, so we don't have to work under those restrictions of those federal grants. So that brings us to a total of about 30.8 million, with just over 16 million of that being in-state funds. The next slide is something that this committee had asked us to bring forth, and it's essentially which non-recurring funds are going to expire after this year. So on the state side, we are going to have $3 million in the safety net, in non-recurring safety net funding expire. And I'll take the privilege of editorializing for about 15 seconds here on this. Safety net funding is extraordinarily important. That is how we take care of our uninsured and underserved Tennesseans. The difficulty when you do non-recurring funding, and don't hear me wrong, we're incredibly grateful and we do good work with it, but it makes it very difficult when we get non-recurring funding because it forces us to have to do one of two things. Either we have a rate increase for our current providers that we then have to take away, or we onboard new providers that get funded for a year or two and then aren't able to provide that service anymore because the funding goes away. So safety net funding is very important, but from an operational standpoint to our providers out in the communities, particularly in the faith-based and charitable clinics, they're really relying upon these dollars, and so any movement in the safety net area, we much prefer that on the recurring side. The other bucket of the non-recurring state funds that are going to expire this year are multiple different kinds of direct appropriations. Interestingly, many of these roll up into the dental proposal that we are putting forth because we've been trying to solve this dental issue in sort of a piecemeal approach for the last few years, and that was the impetus for the work of rolling it all into one. We are going to have almost $500 million in non-recurring federal funding that is going to go away after this fiscal year. The good news is that it does have the ability to roll forward, and we will carry that forward. Many of those funds will last into 23, 24, and sometimes in 25. So we're not particularly concerned about that, but I wanted to be transparent about that question. And then the other one is a small amount for interdepartmental grants, such as criminal justice. So speaking of COVID-related funding, there have been 3 big buckets of work that we have earmarked our ARP funds for. Now, this is a little bit, I want to make a little bit of a distinction between our ARP, American Rescue Plan, and our CRF funds, which were some of the first funds that we received. So one of the really big ways that we've been able to serve Tennessee providers, and particularly hospitals who have done such phenomenal work, and the lion's share of the work during this pandemic has been through what we used to call hospital staffing assistance grants, but you might have caught the term that we changed it to healthcare staffing assistance program. I was making the point earlier that some of this was through CRF. The total has been about $170 million, maybe just a little shy of that. But 120 of that's from ARP. The rest is from CRF. The reason we changed the name is because we are expanding that not only to hospitals, but now to include nursing homes and long-term care facilities. The second bullet point is one that I'm really excited about. Your local mayors are really excited about because they call very often with gratitude, and you should be proud of it as well. This is just shy of $130 million for improvements in local health departments. And if there's anything that public health does well, is maximize services with little resources. And so we want to make sure that our facilities are up to par and up to the standards that our patients and Tennesseans expect. So with this nearly $130 million, we're going to be able to make available a minimum of $450,000 to every single health department of our rural health departments in the state. And 17 of our rural health departments are going to be fully replaced. We were able to undertake a facilities review from our internal facility staff, and we've had kind of a wish list for several years now. And fortunately, through this federal funding, we're going to be able to replace 17 of them completely, 5 of which are in distressed counties, but all of them will have almost $500,000 for renovation. And then finally, our new state public health laboratory. I mentioned that Chairman Watson and I toured it yesterday. If you'd like a tour of it, it's one of my favorite places to go. I'm happy to take you out there. It's a really neat space, but what you will see, it was built in 1950 as an old tuberculosis hospital. And so as you go through the building, what you see is not only is it sort of inefficiently laid out because you've got all of the patient rooms, so they've taken out the walls, but you can see where the patient rooms used to be. It's also no longer efficient for the innovative technology that we have. There's lots of machines that connect to each other, people that need to work with each other on this. And so this has been a $200 million replacement facility in the same general spot out in East Nashville, close to TBI and where the state medical examiner's office is. And so we are really looking forward to that. And then I wanted to close out today to remind you that we do more than COVID in the department. We're really looking forward to doing more than COVID in the department. Wanted to quickly go through our strategic priorities for you to let you know what we're excited about getting back to. This is our mission that we came up with, and we underwent a whole strategic plan probably in summer of 2019 to protect, promote, and improve the health and prosperity of people in Tennessee. And we want to accomplish that through 2 primary goals. One is prevention and one is access. So on the prevention side of things, these are actually our strategic objectives in our strategic plan. You can see there are 5 on the prevention side. So one is improve local health metrics by doing what that local community needs. The mechanism by which is accomplished through county health assessments administered by county health councils. So supporting them and moving them along their journey, recognizing that the fact that Lawrence County and Knox County do not have the same needs. Secondly, decreasing youth obesity. One of the very strongly evidence-based pieces of work for youth obesity is WIC participation, which provides healthy foods to pregnant women and young children, as well as working through our Office of Primary Prevention for built environment, making sure there's access to greenways and playgrounds and places where folks, particularly kids, can get physical activity. You've heard us talk many times about our objective to decrease tobacco use. That is not only trying to prevent that upstream, primarily in youth and as it pertains to electronic cigarettes, but also offering cessation services to everyone, particularly pregnant women, where we know outcomes are better when they stop smoking during pregnancy. That's through the Baby and Me Tobacco Free program, but also other cessation services like the Quit Line. And services for adults. Decreasing substance misuse is certainly one of our priorities. We've talked a little bit earlier about the need for robust data analytics and monitoring the overdoses and intervening and trying to prevent those. And then finally, preventing and mitigating adverse childhood experiences. When you look at many of these outcomes that I've already mentioned, whether it's obesity or substance use, tobacco use, chronic disease, Most of those can be tracked directly back to adverse childhood experiences and childhood trauma. One of our very strong programs that is evidence-based, has it in the name, evidence-based home visiting, as well as trauma-informed training to people in our communities to know how to respond. And then if you caught on to the prevention and access, you might have thought of health and health care. We are a public health agency, but we also support the health care side of things, particularly as it pertains to those uninsured populations. We have about 56 primary care clinics across our system, but we also want to do what we can to support those others. You heard me reference earlier the safety net. So for those patients that we serve ourselves across Tennessee, we want to be as clinically efficient and high quality as just as any other provider. Every Tennessean deserves that. And so we want to be able to make sure we're doing that just as if they were to get services anywhere else. Likewise, we want to support external access to primary care and other services to healthcare for all Tennesseans, particularly in those underserved areas and our rural areas. The dental proposal that we put forth certainly addresses that. And then one strategic objective that's a bit more conceptual versus practical or actual is how we leverage innovation. So how do we take what we see and what we know and help inform decisions not only on the state level, but on the federal level to innovate on our delivery models and our reimbursement mechanisms to make sure that we broaden access and do it in the most cost-efficient and affordable way. Chairman, I think that is it for us, and we are happy to take questions.
Thank you, Dr. Piercy. We appreciate that. I'm sure we have many questions. Before we get into the broader ones, if you could just, for me, you mentioned the decreasing tobacco usage, and you mentioned the electronic cigarettes. Can you help me understand exactly what we're doing in that arena? Because it seems to me that I see more and more people, particularly younger people, vaping, and I'm not sure that we have a really good idea sometimes of what's even in the what material it is that they are taking into their bodies. So how are we addressing that issue?
That's an excellent question because it's something that we have certainly seen, and there appears to be a mentality that electronic cigarettes or vaping is somehow safer than combustible tobacco, which we all know is not. I'll ask Dr. McDonald to speak to some of our efforts on both the youth prevention side as well as adult cessation.
Sure, I'm happy to. And Chairwoman, you're right. The incidence of youth vaping is certainly increasing across the country. We've seen pre-pandemic and then during pandemic, 1 in 4, 1 in 5 high schoolers has vaped in the last 30 days. And so we have actually partnered with youth across the state in a number of youth-driven efforts to both engage them in that messaging. You've hopefully seen some billboards across the state really featuring them and their work because we feel like very strongly they need to be that voice. And the recurring money that was put into the budget last year has gone towards those efforts as well as cessation efforts for both adults and for youth.
Right. Thank you. And then on to my broader question. Your department received over $1 billion in COVID relief as of December of last year. Can you just kind of, since we last met here in November, can you kind of tell us how those dollars have been allocated and give us some updates on how that funding's being used or directed?
Sure. So I'll hit the highlights and then I'll ask Deputy Commissioner Webb to fill in. One of the most impactful things we have done with that money is push it out to our providers, specifically our hospitals, and now soon our nursing home and long-term care, because I'm sure no one in this room is unaware of the staffing cost and the staffing challenges. Every single business in every industry is having workforce issues right now. But in some instances, you know, I don't want to say any business is less important than another, but buying T-shirts and baseball hats is not quite as impactful in someone's life as providing hospital care when somebody's dying. And so we have to get our hospitals and our long-term care facilities staffed appropriately because the consequences are too high not to do that. And so when hospitals particularly have been faced with these staffing challenges, they go to their typical, well, I'll just use a contract agency. Well, when the contract rates are 3 and 5 and 7 times higher than what they have been, then they find themselves in a completely unsustainable situation. So, in order to try to mitigate the hit that hospitals have been taking, we've been supporting them with staffing assistance. It's been our first and foremost important work with that money. We will continue doing that. The other funds support all of the other things that we've been doing through the response, which is testing, contact tracing, vaccine, marketing of all of those, and then the other things that you saw on there related to our health departments and our lab. John, you want to fill something in?
I think you pretty much covered it. The only thing that I would add is the difference between November and now. We've spent a little bit more on those large categories that we described, in particularly in testing in the hospital systems. Those have probably been the biggest pushes. We did receive a lot of ARP money that we were just programming in November. And as Commissioner Ely had mentioned, we've got a lot of federal money, and it just takes us a little bit of time to grind through that, and it will take us a few years to do that. But I agree with Dr. Piercy that we've hit the major categories and continue to make progress.
Thank you. And I know that there is a lot of money, and it takes time to spend it and spend it effectively. So thank you. Chairman Williams.
Thank you, Chair Lady. Thank you, Commissioner and staff, for coming. Seems like I've seen y'all already once this week, but happy to have you back. Just a quick question. I noticed January 31st, I think, the Extend Healthcare contract expired. I guess the question is, do we expect to renew that contract either with them or anyone else in that space? Or is that one of the things that we get to see in the rearview mirror for a while? So, any thoughts?
Thank you for the question, Chairman, because there's been an interesting turn of events literally in the last couple of weeks on that. So you're correct in that the Extend contract expired 1/31. And then we've been in a procurement process for the last several weeks in order to select a new vendor. And that bid has been awarded. The interesting thing that has happened in the meantime is that I don't know how many, 5, 6, 7 of the national associations have come out and said universal contact tracing isn't relevant anymore. You need to focus your contact tracing efforts on high-risk settings like nursing homes and specialized outbreaks. So John may want to fill you in a little bit more if you're interested, but we're having those negotiations with the new vendor now to say, this bid that we put out for you, we might not need nearly as much of that. We need somebody, particularly in case we have a big surge again, and we need to re-up those efforts. And those associations do recognize the fact that there could be a particularly dangerous variant in the future. We don't have any on the radar, but that's a possibility that would re-up our need for this contact tracing. So we're not quite ready to put them completely to the side, but we're trying to structure this new contract with the understanding that contact tracing going forward is not going to look like it was in the past. And we've talked maybe in House Health and in other settings about the transition to endemic, which means we're going to start putting more of the contact tracing responsibilities on the individual. Just as if you were to have the flu or the stomach bug, you need to call somebody if you were with them last night and say, hey, I'm sick. And so, John, you want to add anything to that?
Thank you, Commissioner. So do you have to pull back the RFP and start all over, or can you modify that? I just don't-
What we've done is we've awarded the contract, or we've made the award. We're not decreasing the services that were part of the award. We're leaving it as is. With most contracts, the state is not required to do a minimum amount of work for anyone, and we're just reiterating that fact.
Okay, thank you.
Leader Lamberth.
Commissioner, good to see you today.
You too,
And
sir.
as always, thank you for what you and your team have done, especially over the last couple of years. I know when you were first asked by the governor to be commissioner, you did not anticipate it would be in the midst of a pandemic. So
That's correct.
literally, thank you very much for your work and for your team's work. It's been a very difficult journey. So With that in mind, throughout the pandemic, and you mentioned this a while ago, our safety net funding and our providers there have been extremely important. If you could detail just a little bit, and I've got a couple of follow-up questions, Madam Chairman, if I may. What is our safety net funding this year for those clinics that you've already said are so important? And then how is that provider rate increase? What is it and how's it going to incorporate into that mission?
I saw John reach for his mic, so he'll give you the numbers and Dr. McDonald will fill you in on the program.
So we've Chair Leader Lambert, we've got 25 million that was scheduled for FY. I'm trying to remember 22 what year we're in, but fiscal year 22.
Just to elaborate on that, 22 million of that is recurring, and then that 3 million that we mentioned is non-recurring. And so that was an increase. The $2 million, it was 19.9 recurring last year, 22-ish recurring this year with 3 million non-recurring.
And then, Madam Chairman, may I go back and forth a bit? Thank you, Madam Chairman. So if you have a number available on that, I mean, how many uninsured or underinsured Tennesseans take advantage of these clinics? And does that number that you've mentioned, I mean, the 22 million, obviously that's a large amount of money, but in the grand scheme of what we spend on healthcare, it is a tiny drop in the bucket compared to the number of individuals that are accessing these clinics. If you have that available and the funding that we are putting out there, how are we doing as far as funding these clinics on the mission that they are supposed to be fulfilling?
So twofold there. The increase over time that we've seen in recurring funding for Safety Net has gone both to increase the number of clinics. So we put out an RFA last fall, and I think that was 9 clinics, 7 dental and 2 primary care, if I'm recalling correctly. And it also increased the reimbursement rate. So on a per encounter basis, and this was a significant request, of course, during the pandemic in particular, the provider rate increased, I believe, from about $23 a visit to $47, $49 a visit. There's several 100,000 patients that benefit from that additional funding in the safety net.
Do you say 100,000 additional patients?
I want to say 250,000. Let me get back to you on that. We just issued our safety net report, and we'll happily send that to you.
Okay, yeah, if you could give me some
Sure.
details on that, that would be wonderful. And then what more can we do to assist specifically with that? And I say this because in my district, we have these services and they're extraordinarily critical to those that are what we all many times poor. Those that are trying everything they can, they're working hard, they're climbing the ladder. They're either entry-level employees, they're employees that have left a job and are transitioning to something else. It's folks that many times they need transitionary care before they get into a job that may have full benefits. The current systems that are out there many times are not nimble enough to do that, except for these rural healthcare safety net clinics, which are. So how are we accomplishing the mission now, and what more can we do?
That's a loaded question, and a good one, and one that we spend a lot of time thinking about, particularly with those safety net clinics and the organizations that represent them. I think to Dr. Piercy's point, having that as recurring funding, so when there are increases, so there's not a lot of up and down, it's predictable what they can budget for the coming year. And obviously, as we're able to increase the number of clinics that are out there, again, maintaining a stable reimbursement for those clinics. We've also been working with them a fair bit on quality improvement. How can we build their infrastructure so that they can measure outcomes? We're not just paying for an encounter, we're paying for a service that they're proud of providing, that people really are seeking. So that is a partnership that we've had ongoing with them for the last couple of years, and we expect to be finalizing over the next couple of months. And in that quality improvement process, also working through things like care coordination. So as you're saying, really partnering across healthcare and social service entities, how do we make sure that we're addressing maybe not just the blood pressure, but also the access to food, healthy food that is driving that blood pressure, access to work and insurance as well. So a lot of work going into that.
Madam Chairman, last question. So of the CARES Act dollars, literally the billions of dollars that we have leveraged, how much of that has gone towards rural healthcare clinics, both for-profit and nonprofit, quite frankly? Any idea as to how much of that has been leveraged? And I keep hammering on this because we talk about insurance a lot, and that may catch a large number of people, but you are always going to have folks that are outside of the insurance market that need actual health care. It's one thing to have insurance. It's another thing to actually receive the health care. I've always tried to focus much more on the actually receiving the health care. So how have we done as far as CARES Act funds and federal funds in general that have come down to be able to leverage those toward these clinics?
Yeah, there have been some direct provider relief funds that have gone from HRSA largely to providers and to some extent FQHCs, but also other clinic types. And again, that's direct from the federal government to those providers. And then we, early on before that started, we had some designated funding from CRF in particular to support testing and safety nets first, PPE and safety net, and also revenue loss within the safety net. So I think that was around 6 million. John, you may have a more defined number.
I'm sorry, around how much it faded off there at the end. I apologize.
Sorry,
You may have just gotten back from the mic.
We scheduled 6 million for that program early on in the pandemic, probably summer of 2020.
Okay. Thank you, Madam Chairman. And thank you again, Commissioner and your staff. Appreciate all y'all.
Thank you, Leader.
And I would just add that safety net hospitals, it's not just a rural issue. And in the urban area I live in, we have Volunteers in Medicine. We have a number of ways to get health care to those who are, there's a difference. The access is there in terms of physical, geographic access, but having financial access is a different story. So those are important in urban areas as well as rural. Next on the list, Chairman Whitson.
Thank you, Madam Chairman, and Dr. Piercy, good seeing you and your team. And again, I just want to express my appreciation and respect for you and your team and all that you have done for our state and our citizens over the past 2 years. It's been very difficult, but great job that y'all have done.
Thank you, sir.
My question has to do with suicide prevention and the Tennessee Suicide Prevention Program that we created in 2018. And first of all, I want to thank you for updating us on the status of the Suicide Prevention Director and where y'all are moving forward on that. My question has to do with, in 2020, the Centers for Disease Control for Comprehensive Suicide Prevention awarded the department a grant of $750,000 per year from 2020 to 2025. And just, can you give us an update how the department plans to utilize this grant for suicide prevention?
Thank you, Chairman. And you're making me feel smart today for bringing Dr. McDonald with me because she also oversees that program. So I'll ask you to for her to fill you in on that.
Just to reiterate, there was both the state legislation that created the suicide prevention program, and then that enabled us to be positioned to receive a federal grant that does end in 2025. Some of the work that has happened, this is largely a coordinating role. So Department of Health, you're familiar, we have a lot of the data that then informs action, both suicide itself as well as ER data. So kind of it's a surveillance system that we actually look at youth and adult, but largely youth suicide rates in emergency departments. And then when we see an increase in a region, we can notify schools, we can notify the local TSPN network to act there. So that's been a lot of that infrastructure that's been built. We also coordinate obviously with Department of Mental Health and multiple other Veterans Affairs, multiple other state entities in a large stakeholder group that meets, I believe, quarterly, and issue a number of reports on the activities of that committee. And then this grant funding has been community-based, but also school work in suicide prevention, bullying prevention. So kind of those upstream suicide prevention efforts that, again, has been in coordination with stakeholders across the state.
Thank you, Madam Chairman.
Chairman Zachary.
Thank you, Madam Chair. Good afternoon, Commissioner Piercy. Good to see you guys. Quick question related to the upgrades to the license and regulatory systems in which you're going to be using the health board reserves. Can you tell us how you determined the utilization of those reserves? Because some balances were negative all the way up to $9 million. Can you just elaborate on that, please?
Yeah, Chairman Zachary, we usually we do. We base the allocation on the number of licensees. So if you have a higher number of licensees, then there's probably a higher usage, and you pay a little higher amount.
Thank you, Madam Chair. Commissioner, your team, we appreciate you very much. We were Commissioner Ely was able to borrow Mr. Webb yesterday to give us some conversation. And I want to go back a little bit to yesterday. We talked about the new county health centers that we're talking about and replacement of 17 county facilities. And I think you said, you offered up, John, if we want to know if our county's in there, where they could be. But could you, off the top of your head, could you give us the 17 counties, or at least the 5 distressed counties that are in there?
I don't have that list with me, but I'm happy to supply that to the committee.
And if you could, and I think there's 17 county facilities completely new, and facility renovations in several others, and most every county health department is going to get something. So if you could share
Yeah,
that with
I'll
us.
get the 17 new, and then the 27 we schedule for major renovation, and then I think that should fulfill the request.
That's great. And just a second question as well, and we're flying a little bit blind up here. We don't have the PowerPoint on our what you call it? Dashboards, excuse me. So can we go back to the first, when you talked about some of the improvements to the budget there, you're talking about dental services, and part of that was new dental residency programs, bringing new dentists into the state. And I'm going to ask, out of somewhat naivety, I should know the answer to this, but we've got some residency programs that we can fund through our TennCare program. Are there some dollars that we can draw or leverage to the TennCare program as we're looking at dental residency programs?
Thank you for the good question, Chairman. I'll try to answer you as best I can. The key thing to note is that dental residencies and medical residencies are funded entirely different. And so this initiative actually does not contemplate dental residencies. That may help, or that may ultimately result. What this proposal contemplates, about 2/3 of not only this year's line item, but the overall package, is to increase the actual dental class size. It might surprise you how few dental school slots we have in Tennessee. So UT Memphis has 100 slots. I'm using round numbers, 100 slots, 30 of which have to be for Arkansas residents. So 70, because Arkansas does not have a dental school. So only 70 UT slots are available for Tennesseans, and obviously those aren't exclusively for Tennesseans. Then Meharry has about 60, maybe just north of 60 slots in their program. LMU is starting a dental school next summer. They have not matriculated any students yet. It's my understanding that they plan to offer 80 slots. So this part of this proposal increases the number of dental school slots at both UT and Meharry, and then eventually, if LMU gets into that same situation, it would be amenable to that as well.
Thank you, Madam Chair. And it sounds like we're attempting to cover the Grand Division, so thank you very much. In terms of dental services, I know we're trying to get dental care inside our county health departments as much as we can, in many areas that we can. Is there any other dollars we can leverage to do that as well? And that'll be my final question. Thank you, Madam Chair.
Absolutely. I'm so glad you asked that, because we have a little over 3 dozen of our health departments that have fully equipped dental clinics. And in all honesty, they're some of the nicest dental clinics I've ever seen, much nicer than the ones I've personally been to. The problem that we have is at least 1/3 of those, and sometimes up to half of those, are completely dark because we can't staff them. And we have a deficit of 700 dentists in the state right now. And so because they're in such high demand, when dentists come out of school, they have some pretty lucrative opportunities awaiting them. So it's difficult to recruit to public health dentistry. Likewise, we know that there's probably going to be about 1,300 dentists that are currently practicing that are eligible for retirement in the next 10 years. So this is why we really felt the need to get upstream and start putting more out in the pipeline. But that's not all that proposal does. It also helps on the back end to recruit, retain through loan repayments, and other incentives to get dentists, instead of going to practice in a suburban high-income area, to actually incentivize them for rural and underserved, because we know there is a very direct link, not only with dental health and physical health, but also dental health and economic prosperity. Because if they don't feel good, if they're not healthy, and they don't have that confident air about them because they have poor dentition, they are most likely not to be working at the top of their license either.
Representative Gillespie.
Thank you, Madam Chair. Commissioner, thank you so much for being here. Really appreciate all the effort that your department's done for us over the last couple of years. This is a question you might not have the answer to right now, but I'd love to just hear something right now and then get back to me at a later time. There are a lot of, whether it be LPNs, RNs, doctors, lots of people in the healthcare industry that I'm hearing are going from maybe a hospital setting or a private practice setting to, say, a skincare or Botox, things like that. Does the department track? And I think a lot of that has to do with burnout and things like that of the last year and a half, 2 years or so. Does the department track any of those kind of, if they're still licensed as an RN or whatever the case may be? Is that a concern that people are leaving those fields but not entirely leaving?
So what you're talking about is people going into aesthetics and more cash paying business because as whatever the famous bank robber's name is, that's where the money is. um, we don't see that anecdotally. We don't see that in massive droves. It's absolutely happening. But the rest of my response will be a bit self-serving because we don't have any way in our current licensure system to say, well, what kind of practice are you? For example, my license just says MD. It doesn't say I'm a pediatrician, and it doesn't say that I don't practice full-time anymore. It just says I'm a licensed MD. So the self-serving part is if we are able to upgrade our licensing system, we will be able to do better data collection because, for example, like when we were trying to get out tests or get out vaccines, we might shoot a communication out to every physician or every nurse, but we don't know are they in primary care practice? Where is their primary practice? Or are they practicing in multiple spots? So the short answer is we don't know because we don't collect that data, but that's something that a new system would really help us do better.
Chairman Hicks.
Thank you, Chair Lady and Commissioner. Good to see you again, you and your staff. Representative Hall kind of stole a little bit of my thunder, what I wanted to talk about, and it was the expansion of the dental services. So this is year one of a pilot program. How many years will that be in total, do you foresee?
Yes, sir. The work group suggested a 5-year pilot. We put out a report in October, and I'll write myself a note to get you that full report because it lines out by year the different actions and the budget per year. And if that can be accelerated, we're amenable to that. But this is certainly a multifaceted and multi-stakeholder approach. I wish it were a one and done silver bullet, but it's going to take a lot of different avenues of work.
I appreciate you saying that, and I'd love to see that. And I know there's 3 line items. So I know the first one says contract with, of course, UT and Meharry. What will that look like when that's carried out? How will that money be dispersed? I think it's $6.6 million. So, and you can just briefly tell me how will that money be sent to those institutions?
If you're asking logistically, I'll have to defer to John, but programmatically, that is to support faculty and all of the infrastructure related to increasing class size. John, do you have? Is that right? Okay.
And then as far as what will the dentist recruitment, the 1.1 million, what will that look like?
That's the loan repayment and incentives, the recruitment incentives. That is can be modeled or even wrapped into a program that we already have called Tennessee State Loan Repayment Program, also known as TSLRP, which incentivizes providers after some time commitment to practice in rural areas. And so that is just expanding that to dentists and making sure we can get them into those underserved areas.
And then the prosthodontics, that's a tough word for me to say, but what about that one? How will that be carried out?
Sure, that's a couple of big buckets. One is prosthodontics is fancy word for dentures. So prosthodontics for the uninsured. Obviously, we've already talked about chewing food and being healthy and having a good smile, and the uninsured certainly deserve that as well. Another big bucket of that is a program we call Smile on 65 Plus, which is essentially a case management, dental case management for the elderly.
Well, again, I appreciate seeing this in the budget. I do. And I also, something else you said also caught my eye was the fact that when you mentioned the dental schools, you did mention LMU. LMU is going to be coming on board. I think it's actually in August. I think will be their first cohort. And so here's what I care about at the end of the day. I appreciate UT being on board because they're going to be in my neck of the woods. I appreciate Meharry being on board because they're going to serve who they're going to serve. But LMU, I think, is right there as well. So quite frankly, I don't care what emblem is on that lab coat. I just want those people serving my folks back home, serving Tennesseans across. So I would encourage, as we get further deep into this, since LMU is right there, or any other stakeholder as far as that goes, ETSU with their dental hygienist, I just hope that we offer everyone a seat at the table, because at the end of the day, it's about serving those people, not putting on those lab coats. So and that's my soapbox on that. So I appreciate it, but I'm excited to see that in there, and I thank you for pushing this.
Thank you. Thank you, sir. I did have a really good Zoom meeting with the new dean at LMU a couple of weeks ago, and she certainly emphasized the focus that they are going to have in serving the rural community. Likewise, Dr. Nolan at ETSU, he has a big dental hygiene program, and I've been able to connect him with some other folks to talk about how we can even expand services in their area.
And just to add to that, I visited with some other legislators a few months ago at South College. They're here, they're in Knoxville, and perhaps looking at other locations. And it's great to have dentists, we need them, but you have to have dental assistants and hygienists and all of those things to make it operationally feasible. And they too are graduating a number of those folks along with PAs. And so I think we're in the position of needing to, as Chairman Hicks has said, we don't really care about the source. We care that they're well trained. We care that they know what they're doing and they're able to take care of Tennesseans. But we just need to get these folks out in practice in our state. So anything that we can do to speed that along. Representative Lynn.
Thank you, Madam Chairman. Commissioner, you're obviously very busy, and I wanted to ask you, just anecdotally, I know a young person who works at a local smoke shop. There was a product called Delta 8. Where I work, there is a woman whose daughter's boyfriend just got diagnosed with schizophrenia, and he was using Delta 8. And when he was diagnosed at the hospital, they said they're seeing increasing numbers of young people who use Delta 8 getting diagnosed with schizophrenia. And whether or not it's permanent yet, it's hard to tell. What are we doing about emerging issues like that? And how do we make people aware of that? Because happen to know the smoke shop is still selling the product, whether it's a quality thing with the product, I don't know. I have no idea, never touched it, wouldn't even know what it looked like. But it seems like it could be an emerging issue based on what the hospital told this young person's family.
Thank
So
you
what
for
are
the
we doing about that?
Thank you for the question. I will be the first to admit that I too am not adept at all of the ins and outs. What I believe you're describing is one of the synthetic products, and what we do know are the synthetic products are unregulated and they're highly dangerous. And it's one of those situations, sort of like my friend Director Roush at the TBI finds himself in. You're always chasing something because they're always going to have one step ahead on something because there's a demand for it, quite frankly. And so I'm not sure if our programs address any of the synthetics, but we certainly something that we're keeping an eye on.
Representative Miller.
Thank you, Madam Chair. Commissioner, thank you all for being here. You said it earlier, Health Department, you do much more, responsible for much more than COVID-19. It's been some great questions, but I just want to go back to the $1 billion investment. And I don't know if I'm personally overconfident, or just following the crowd. How safe are we? I know that's a general question. How safe are we, our citizens, state of Tennessee? Give us a brief summary if you can. How safe are we?
Yeah, that's a big question. I'll take a stab at it, and then if you want me to redirect, I'm happy to. Right now, as it stands, we are in a precipitous decline from the Omicron surge. The headlines that you've seen, whether it was MNPS this morning or other large entities, everybody is seeing this sustained decrease. I would like to sit here and tell you that we're done with COVID, but we're not. It's not done with us. We may be done with it, but it's not done with us. What we have seen, though, that has been different over the last 2 to 3 months, so during the Omicron surge versus all the other surges, is this much talked about concept of moving from pandemic to endemic. The last time I was testifying in a committee, I was asked to define endemic. And that's a difficult definition because there's not one day that you're going to wake up and say, okay, it's over, or it's endemic, or everybody go home, there's nothing left to see here. It's going to be with us for a very, very long time. But what we saw during Omicron is that the percent of vaccinated people, as well as those with natural immunity, really decreased the number of severe illnesses and deaths. Yes, there were still hospitalizations. Yes, there were still deaths, and I don't ever want to minimize those. But as a society, we have been able to much better integrate this into our daily lives. And you're starting to see that around the country of we're not going to disrupt our day-to-day living. Now, that doesn't mean we should go out and, just have a big COVID party or do whatever we want to. We still need to be smart, particularly when the virus surges. And so you're starting to see things like, continued campaigns of hand washing and removing oneself from close environments. But the days of universal masking all the time, everywhere for the general population are over. If you're in a high risk category, you absolutely should still consider that. And just because you don't have to in some places anymore doesn't mean if you feel safer doing that, you shouldn't. But I'll end that diatribe with the thing that I will say every single time: vaccination is the single best thing you can do to protect yourselves and those around you.
Representative Miller. Microphone.
What ACEs and what resources are we putting into to mitigate and exactly what it is and how successful are we with this?
It's your lucky day you have 2 pediatricians sitting in front of you. And we deal with adverse childhood experiences all the time. You've probably heard me say before, I am a child abuse pediatrician. That's my training. And so I deal with traumatized children. That's what my career has been about. And what you see is you don't make, it's sometimes not intuitive to make that link between how sexual abuse at age 4 or 8 can result in hypertension and obesity at age 45, but there is a direct correlation. You can kind of fast forward and think about self-medicating with food, self-medicating with substances because of the trauma that wasn't identified and treated early on. So I'll ask Dr. McDonald to give you a brief overview of how we're doing that in the department. One of the programs that we're most proud of and that is most effective is our evidence-based home visiting program. So I'll let her tell you a little bit about that.
Sure, and thank you. And I think particularly that emphasis on ACEs in the height of the pandemic and what we've been through for the past 2 years is all the more pertinent for discussion. We do, as a state agency, fund a number of community-based entities to now have evidence-based home visiting in all 95 counties, which was a huge accomplishment and a partnership between our department and DHS. And that really is walking alongside parents. And there are a couple of different models that has been shown to reduce child abuse, to increase kindergarten readiness, to decrease arrests even in adolescence, and to improve high school graduation rates. And so that investment is 2 to 5 fold for every dollar that we've invested there. And that's kind of just one of the ACEs interventions that we've implemented.
All right, Dr. Piercy, we thank you for your patience in waiting through our business earlier, and we thank you for the presentation, you and your team today. And most of all, we thank you for all of the hard work that's been done by your department and so many other people in navigating through a very difficult situation. So we do appreciate your work. We all know we're always looking for ways that things can be done better, but we know that very difficult circumstances, and I think your department has performed admirably. So thank you. And again, we apologize for holding you up earlier.
No, no worries. Thank you, Madam Chair, and thank you, committee, and to the General Assembly at large. We have felt nothing but support and help all along the way, and so we're grateful for that. It's meant a whole lot to both my executive staff, but also my field staff, to know that you've got our back. So thank you for that.
Thank you. We have the Department of Human Services. We're moving to the front. Let's see, Taylor's. Oh, there he is. Commissioner Carter, welcome. And through no fault of your own, we are running way behind. So I'm going to ask if you can to be as brief as possible in your presentation and give us some time, for questions. And I do apologize for that, but we had some business to take care of that took a little bit longer than perhaps we expected. So with that, I would just go directly into your presentation, if you will.
Madam Chair and members of the committee, my name is Clarence Carter, Commissioner of the Tennessee Department of Human Services, and am pleased to present our 2022-2023 budget. I am joined today at the table by my Deputy Commissioner for Programs, Sherelle Campbell Street, Deputy Commissioner for Operations, Melissa Hux, and our Budget Director, Wynn Shires. Okay. So let me dive right in and with just a couple of highlights. In fiscal 21, we served through our Child Care Assistance Program, we served 21,000 children. With our pandemic child care, we served more than 58,000 children. And in our partnership with the YMCA, we served about 27,000 children. In our pandemic employment, our pandemic emergency benefit transfer, we served, oopsie, I need to get a little bit closer. Sorry about that. We passed out benefits of more than $800 million. In our summer food service program, we served 6 million meals. And one of the numbers I'm particularly proud of, in our child support program, we served more than 1 million Tennesseans, collecting over $630 million for Tennessee children from their non-custodial parents. Okay. I'll briefly touch on our TANF Opportunity Act. We are in the second phase of the administration of that initiative, where will ultimately wind up with 7 pilots, which will test this idea of growing capacity to reduce dependency. And if I could just make a quick shout out to Representative Hawk for his help on the TANF Advisory Board. We had developed a pretty complex methodology by which we would determine planning grants. And Representative Hawk, on the back of an envelope, sketched out something that was a lot more simplified, and it kept this from a 2-day meeting to about a 3-hour meeting. So most appreciative for your for all of your help in that. It wound up with, we have 17 planning grants that there are 4 to 5 in each of the 3 grand divisions, which touch every one of the 95 counties of the state. We will settle on those 7 pilots by the end of April, and moving forward smartly on our TANF Opportunity Act. And And again, those pilots, we will expend $175 million, $25 million per each of the seven grantees, and another $5 million in evaluation for our pilots. Let me run quickly through our budget. We have three budget items. The first is or three increases. The first is a $1.6 billion increase in our SNAP benefit program. This is 100% federally funded, and it is based on the recalculation of the Food and Nutrition Service on the benefit amount. So this does not open new eligibility. It expands the amounts available for existing individuals and families. And in that regard, we don't need additional state are not serving a broader population. The initiative that we are most excited about is our collaboration between vocational rehabilitation and the mental health services, where we are looking to take an evidence-based practice called individual placement to work to help individuals with significant mental health challenges to get them to be able to work. We believe that everybody who can work should work. We simply, in this instance, need to provide more of a hand-holding to help individuals work in the context of the mental health challenges they have. And so this is a collaboration between us and mental health and substance abuse, which makes this available. This is very, very exciting. And finally, the child support assistant district attorneys step increase of $129,000. So and what I just wanted to highlight here is that DHS is almost 96% federally funded, and what we use in state funds are used to draw down the federal funds. We will be in 22 and 23 a $4 billion agency, which is double the amount of our operating budget traditionally, but this is, of course, with the addition of pandemic spending. And of that $4 billion, about 192 million is state funds that draw down that excess, that draw down the federal funding. So, Madam Chair, that's enough of an overview, and so we will let the committee have at it.
Thank you, Commissioner. We appreciate your brevity. It's late in the day. I do have several people on the list, beginning with Chairman Baum.
Thank you, Madam Chair. The department recently requested permission to use federal funds to hire some additional folks in positions for, I guess, disability determination claims. And I was just wondering if you could give us an update on how many positions were filled and to what extent that has relieved some of the backlog in the state.
And so I'm going to give you the headline on this and then ask my deputy for programs to fill in. So these are positions that are funded by the Social Security Administration, and they have complete authority over when we can hire. And so we simply got permission to be able to hire a new cadre. And so that's what we are, what we have done. And now, any other issues attended to that? Sherelle, you want to?
Me. Oh, good. Okay. Hi. I've always wanted to do that. I'm sorry. Yes, sir. So, as Commissioner stated,
if you would just identify yourself. For the
oh,
record,
I'm so
please.
sorry, Representative Haber. You think I would know this by now. Sorry. I'm Sherelle Campbell Street. I'm the Deputy Commissioner for Over Programming Services at the Tennessee Department of Human Services. And as Commissioner stated, our Disability Determination Services is a 100% federally federally funded program. It's a partnership between us and the Social Security Administration. That program has people are identified as disability claim examiners, and they make the determination for they make the medical determination for people who will receive disability services. We're somewhat, and I say this with affection, we're sometimes at the mercy of Social Security to on how we fund and support those positions. They have a different, each year they have a different focus. And so based on the focus area that they have an abundance of claims, they will say that we want to kind of shift operations to do X. And so right now we have a really robust system here in Tennessee, and the examiners are meeting the immediate needs as identified by Social Security.
Okay, thank you for that update, and I do want to thank you all for the good work. Thank you.
Representative Ogles, you're recognized.
Thank you, Madam Chair. Thank you, Commissioner, for being here today and all the great work y'all do. The governor's proposal includes expansion of funding to DHS for a placement of individuals with severe mental health obtain employment. Will the expanded funding, will it expand the areas where we're doing that, or will it just enhance where we're actually helping now?
No, this won't enhance the areas or where we are doing it. It will provide for additional support counselors, if you would. This is a very labor-intensive intervention because the individuals that have these kinds of significant mental health challenges really do need a significant amount of hand-holding. So it will increase the number of individuals that we have to be able to provide that very case-intensive support.
Okay, so thank you, Madam Chair. So in summary, we're going to expand the services where they're already provided today. We're not really expanding the network of where those providers are located across the state.
That is correct.
Thank you.
Chairman Hawk.
Thank you, Madam Chair. And to Deputy Commissioner, every time I see a mic, I want to say, hello, I'm Johnny Cash. London Lamar is the only one who laughed at that. Let the record show that London Lamar is the only person who laughed at that. Commissioner, thank you very much for your conversation. Chair lady obviously did not laugh about that. So, I'm watching. Thank you for the recognition on TANF and the great work that has been done, and so many folks, Chairman Terry, Chairman Smith, so many folks have done some good work. Representative Love has done some good work too. So thank you very much. As we're talking about TANF, April 7th is a big date for the Tennessee Opportunity Grant. The Opportunity Planning Grant, folks, can you talk a little bit about the April 7th date and what will happening then?
Sure. What will happen is we currently have 17 planning grant awardees. So these are organizations that submitted to us compelling proposals for how their community collaboration will approach this idea of growing capacity to reduce dependency. So on April 7th, we are asking for presentations in almost a Shark Tank format. We want to determine who are going to receive these 7 pilots based on not just what they put on paper, but how they bring that to life. And so the TANF, the Family First Advisory Committee will convene for 2 days to allow each of the 17 to share with us in very real time how their proposal will work. And it's from that, and then of course the paper review, that the Families First Advisory Council will make decisions on those 7 pilots. And again, there will be 2 pilots in each of the 3 grand divisions, and a 7th one, which the Department of Human Services will operate. But that April 7th is a big day for Tennessee in that regard.
Chairman Hawk.
And I've cautiously asked to be recognized again by the chair lady. The Opportunity Act also increased the monthly cash allotment for recipients to $387 a year. Have we been able to quantify that in the budget yet? Have we been able to see where we are month to month to month on those allowances?
Melissa, grab that, please.
Good afternoon, Melissa Hux, Deputy Commissioner at DHS. We have not been able to quantify that yet as numbers come out, but we can put those together and report those back to you.
If you would just get those to my office and we'll distribute them to the committee.
Yes, ma'am.
Representative Garrett.
Thank you, Madam Chair. Thank you all for being here. We appreciate it. You briefly mentioned the SNAP funding, and I understand that that waiver is ending. And just to talk about a little bit what we're going to do, does the department think the increase in SNAP allotments will expire, or will you think it'll be continued indefinitely?
My suspicion is that in the context of this administration, the likelihood is that the allotment will continue into the foreseeable future.
Good deal. And then does the unspent federal funding within the SNAP program revert back to the federal government at the end of this fiscal year? And if so, with the end of the SNAP to the max waiver, is there a chance SNAP funding will have to be returned unspent?
No, because the way the SNAP benefit works is we move that benefit based on what the eligible amount is to the individual or family. And so it is off our books. So there isn't anything that would be returned. If something is unexpended, it would be unexpended on the card that individual or family has. It's not something that would revert to the federal government.
Oh, good deal. Thank you for that, Claire. Appreciate that. Thank you.
Chairman Zachary.
Thank you, Madam Chair. Good afternoon, Commissioner and team. Commissioner, even before the pandemic, we've had some challenges as a state related to childcare affordability. Since the pandemic, that has just increased, exaggerated that issue related to workers and then families being able to provide adequate childcare. Can you speak to just briefly the relationship with ECD regarding rural areas and trying to grow the childcare opportunities, and then just how we're addressing the hurdles related to childcare facilities opening and running new facilities?
So let me go in just a couple of different directions. The first is that the legislature created a child care advisory task force for just this reason, to look at the broad issue of child care affordability, availability, and quality. And so that committee, which Chair Hazelwood sits on, we are progressing in trying to get our heads around that issue. But there are a couple of things that we know. There are some significant child care deserts. We don't have enough quality and affordable child care in Tennessee. And so we have got to be more innovative about how we go about doing that. And so in a couple of different directions, you mentioned one, we are working with ECD in that in one instance, they are able to provide money for bricks and mortar, which our Child Care and Development Fund can't. So we are collaborating on doing the programming where they will actually build the facility. Okay, so that's one way that we are trying to address the issue. And on the employer side, because childcare is vital to employees being able to do the work, but it's also vital to the employer to be able to have an employee that's freed up to be able to do the work. And so we are working on some very innovative partnerships with employers where they will make childcare available as part of their facility. And we are looking at and this will be a 3-shift facility, so that we'd have childcare available literally based on the shift. So what we are trying to do is to encourage that partnership with employers, because this is such a this is so important to both employer and employee. So we're trying to go in several different directions to address this issue of accessibility, affordability, and quality of childcare in Tennessee.
Chairman Zachary.
Thank you, Madam Chair. Just a quick comment. Thank you for your passion and the work that you and your team have done. My colleague and I were just talking about your passion is infectious. So thank you for the way you approach and serve Tennesseans in that way.
Thanks for the acknowledgement.
Chairman Todd.
Thank you, Madam Chair. As I understand it, the department has received a little over $3.25 billion as of a couple of months ago in COVID relief money. Has the department had success in getting those funds out to Tennesseans in need, or will some of the funds likely have to be returned?
So we have had success in moving those dollars to where to families in need. What I would say is that we have had some unique collaborations with community partners. I go back to the beginning of our community cares work when we got the first tranche of pandemic money, and we engaged and this is prior to my arrival. We engaged a number of community partners to sort of serve as intermediaries to then help us, because of their community presence, then be able to move those dollars to a much broader network of community providers. Okay, and so we have had real good success with that. And similarly, we've had to stand up some mechanisms pretty rapidly, but we have had pretty good success in moving the dollars to where to the need that it was intended. And I'm going to defer to Melissa and ask for any federal funding that we think will lapse.
No, sir. So no federal funding should lapse outside of any admin money, and that's just administration, because we have done a great job of maximizing our current staff with the current grants. As far as distribution, we do not expect any to. We are still, as Commissioner stated, ongoing with childcare grants going out, delivering those to facilities to help, based on the previous question, with pandemic EBT and so forth. So we still have several months, if not a year and a half, to expand the funding that we've received thus far.
Representative Shaw.
Thank you, Madam Chair, and thank you, Commissioner, staff, for being here. We were talking, my colleague here we were talking about the pilot programs.
Yes, sir.
The 7 pilot programs from April the
7th.
7th. Can you elaborate a little more in depth on what your primary goal is through this pilot program, and who will be the overseers, I assume, in terms, and how often will you get reports as to how well this pilot may be doing in these different grant divisions?
So, Representative Shaw, thanks so much for the question. So this question comes to the crux of our objective. It has been our perspective that the way the safety net system has worked previously, the emphasis is on the delivery of benefits, goods, and services, not growing people beyond the economic, social, and developmental vulnerability that has them need those services. And so our emphasis here is going to be how, with intention, we achieve that. We will be able to show over the course of the 3 years of these pilots how we have increased the earnings, increase the skills, increase the assets, reduce the bad debt. Those things that have individuals in a circumstance where they have to turn to their government and say, can you provide meager support for us to exist? So we are very intently focused on what we call growing their functioning capacity that will result in the reduction of their dependency. That is what we are measuring.
Representative Shaw.
For those victims, and I'm sure we probably won't be 100%, for those who may not catch the vision, any plans in place for after the 3 years for those people, or will they just continually get the government services as usual and that's the end of the story.
So what it is our hope is that we will learn from these 7 pilots. And what we learn from these pilots will actually result in our being able to adjust our programming so that we bake this into how DHS and the communities operate going forward. So no, we don't anticipate 100% success. What we do anticipate is 100% of learning how, with intention, you grow people beyond their vulnerability.
Thank you. Thank you for being here. Thank you, Madam Chair.
Representative Sparks.
Thank you, Commissioner. Commissioner, I just wanted to read a quote that you said, if it's okay. I liked it. For far too long, government programs have focused on the outputs rather than the outcomes of the lives who have been served. We aim to change the way vulnerable Tennesseans are served by partnering with public and private organizations who recognize public support should be a mile marker in a life journey, not a destination unto itself. So I appreciate your quote. I wanted to ask about childcare. Dr. Love in the back there and I happened to be talking after session the other day, and we were talking. It was one of the clerk's employees. I'm not going to say her name, and somehow I got talking to her about childcare, and she's paying $1,300 a month in childcare. I was like, whoa, how do you afford that? And I think Dr. Love said he had a bill, but I'm trying to address him that. But I guess my question is, what are we doing as far as partnering with faith-based organizations or other nonprofits? And is there any drawdown from TANF funds to help with some of these improvements to some organizations to kind of help offer some relief and partnership?
So the fact is that built into the TANF structure is an allowability to transfer some of it, 10% of it, into the Child Care and Development Fund. But we find that we have an overabundance of resources in the Child Care and Development Block Grant that we simply have to execute more efficiently. So we are trying to use those dollars, but absolutely partner with all sectors of Tennessee to help us address this issue. One of the big challenges of the way our system is designed is that we are very government centric, as if the government is the principal problem solver. And so we have crowded out the community of faith, academia, the private sector, philanthropy, from being a part of the problem solving. So what we believe one of our roles is to serve as a catalyst, to literally call all the rest of Tennessee to this issue, because we believe that while the resources are bigger than any one program or agency, it's not bigger than all of Tennessee. We can make the whole greater than the sum of its parts and solve this problem around making childcare affordable, accessible, and high quality.
Chair Lady, if I could. This morning I was with a music therapist at a church in Franklin, probably in Ogles District. And it's a partnership with the church. They're working with Parkinson's patients. It was just impressive listening to them and trying to just learn about, how it's helping with Parkinson's. A couple of weeks ago, I had a church that called me. They were being threatened to be locked up. The doors, it's a temporary permit they had. River of Life made a video about it on YouTube. Just type in the river at Smyrna. People don't believe this exists in America. But I noticed while I was there with the pastor, families coming in with the children. And I said, what's going on here? He says, well, we have a Mother's Day Out program. Like, well, is this mandatory that you have to be a member of the church? Oh, no. I don't even think they're charging.
Right.
And I remember I got a phone call from the mayor because he's seen the video that I made. And I said, look at the good work these folks are doing. A lot of times I think people miss the boat that the faith-based partnerships can offer so much, and we often forget to leverage that. And I appreciate Gary Farley, Mary Beth Gribble with State Fire Marshal for helping me with that church. But But I appreciate your work and your passion, to echo Garrett's comments earlier, whoever made the comments bragging on you. But maybe we can revisit Dr. Love's bill maybe next year. Thank you.
Sherelle, please.
Yeah. I just wanted to recognize Representative Spark for your unwavering support of the Tennessee Rehabilitation Center in Smyrna. And I think you would be very happy to know that one of the ways that we are actually, the Commissioner is really big on us being one DHS, a moniker that we started a few years ago, but how can not only we look at childcare through the childcare lens, but through TANF or SNAP or through vocational rehabilitation. And so one of the things that they are exploring at the TRC in Smyrna is developing a certificate program that would be state recognized for students to go through to learn how to become child care workers in licensed child care facilities. So that's one way that we're trying to really assist in some of the vacancies that we see in this area. And I'm very excited to, they're doing some research now on a national level to see if that's something that we can do here, and also working with TCAT. So we're really excited. I wanted to again thank you for your support of TRC.
And typically, I start in-depth presentations by sharing a graphic that it looks like some kind of mad artist I did, but it is a depiction of all of the 86 programs that are authorized by the federal government to address economic, social, and developmental vulnerability. And in the center of that chart, it showcases that in federal and state government alone, we spend $1 trillion a year in those programs, okay? Now, that $1 trillion doesn't count a penny of the intervention of that church that you talked about or anything else. It just depicts federal and state government money. My argument is we don't need more. We have to leverage and align what we have more effectively to achieve our objectives.
Commissioner Carter, I wanted to give you kudos. I think you're the first department that's been in front of us that says we don't need more. So
I know that's going to come back to bite me.
But we sincerely do thank you and all the folks in your department for all that you do, and especially over a very trying time for families across the state. I know that you all have provided that safety net in many cases that have kept families afloat. So we thank you for the hard work that's gone into that. And we really appreciate the words that you said earlier. I think we have the resources.
Yep.
I think we have the will, and I think we have the capability. It's just being able to sit down, and that's one of the things I'm hopeful with the Child Care Task Force,
Yep.
that we're able to really look at the problem holistically and bring in all of those other providers, whether it be from not-for-profits or the faith community or wherever they are. If they're providing quality childcare, then we want to bring them into our umbrella. And if they're not providing quality childcare, then we want to make sure that they either don't provide childcare at all,
right.
or that we help them to
get their act
improve so
together.
that the childcare is, what we would want for our own children.
Exactly right.
So we thank you for your patience today, as we were later than we had told you that we would be. And I have no other questions on the list. So without objection, we're back in session. And without objection, we are adjourned.